Yeah, if I had a dime for how many times people have told me, like, my friends or family said this, and I know they want to be helpful, but it made it worse. I just thought I was nuts. Like, I just thought I was being over dramatic.
One of those stigma statements would be like, stop blowing this out of proportion, stop making it a big deal. And maybe sometimes we're trying to do that in hopes to change their thinking. Like, oh, it's not so bad. Like, it may be coming from good intentions, but then what is it experience of that person hearing that?
I could pick one thing for them to leave with, it would be like a bit of hope. We can get on the same page and we can start taking steps towards what it is that they're looking for. If someone's telling you something, they trust you, they've given you that trust. So like slow down and just hear what they have to say. How would you want somebody to respond to you if you were telling them something vulnerable?
We are excited today because we get to talk with Whitney Ireland, a psychologist out of Alberta, Canada. So we have broken some international barriers, and we're going to be talking about stigma. We're going to talk about what it's like to receive mental health services in Canada, and we're also going to learn a little bit about what it's like from the clinician side of the couch. So I'm really excited. I hope you guys will enjoy. Let's get to it.
Can I still feel grounded in these belief systems and entertain other ideas?
Finally, they sent me to prison. That was it for me. From that point forward, I will do whatever it takes. This is not the life that I want.
This is a thinking disease with a using problem. They're not bad people learning how to be good. You're sick and learning how to be well.
So yeah, I'm Whitney. I'm a psychologist. I'm born and raised in Alberta. I actually had an interest in psychology from a young age. I met a psychologist when I was in middle school. And so it was something that I was interested in for quite a while. But I've been working in the field of mental health for 6 years. I've worked in the school district. I've worked with kids. I did my master's internship in hospital. So that was a really cool experience. And then I've been working in community mental health for the last few years. And then recently also been working a little bit in the private sector. So yeah, I've kind of done a lot of different things in the field, but I'm grateful to say this many years in that I still absolutely love what I do. Enjoy getting to do this work with people.
Yeah. And so you said you worked in the hospital for a period of time. Was that for kids or adults?
That was adults. Yeah. So, a couple inpatient units, which was, really eye-opening. And honestly, I wouldn't have traded that experience for the world. It was really, really something.
You learn a lot, right? Yeah.
Mm-hmm.
What is kind of the state of people in your area, especially related to COVID and just kind of their mental health and overall health, and how are they coping?
Like, it's rough. I think everyone's really tired. We shift from, locking down to trying to open up to locking back down. And so that's really hard on people. Just really noticeable how much we miss connecting with people, how much we miss our routines, how much there were so many things that we were just, nothing was taking them away. So we just took them for granted. It was just part of our lives. And then for us here in Alberta, we've actually, oil and gas is a big sector in Alberta. And so with oil prices having been down for many years now, it was kind of a double whammy for us to have COVID along with some of the kind of economic crisis we've had in the province. So yeah, to be honest, things are tough. I think a lot of people are finding that they're maybe newly experiencing some depression, some anxiety, and people who maybe had pre-existing things going on for them. Like, it's definitely challenging.
So I'm curious, kind of in our area, and we talk a lot about this in our podcast about pick yourself up from your bootstraps, like dust yourself off, get back into it, you got to push through and everything like that. I'm curious, has this crisis led to people reaching out more for mental health help, or is that been an issue in terms of your area? As we spend a lot of time, I think, and even the people in our community, the mental health agencies and all that, we spend a lot of time trying to help people feel comfortable reaching out and getting help. And is that something that you guys experience there as well?
We've got a lot of people who are looking for help and not enough services to meet those needs, and not enough accessible services to meet those needs. So yeah, working in community mental health, that's my primary job. Yeah, we're going pretty flat out. So on one hand, as a clinician, I'm always glad to see people reaching out and asking for help. But yeah, it is that tough side of, encouraging people to reach out and then needing to have things there for them. So there's been a lot of push for using digital platforms, for trying to get creative about ways to get people support, particularly in a time where some people can't physically go into a place to get support and stuff. So yeah, I think we are having a lot of people reach out for support. I think we're struggling on the services end of things.
Now, is that because of just accessibility due to COVID, or is that just we just don't have enough people out there that are able to provide that help?
Yeah, I think people, and then I think the financial aspect of things. So enough accessibility in terms of things that people can access either very inexpensively or for free. Even prior to COVID, we were experiencing some tough economic times. And so unless people have benefits through their work, it can be pretty tough to go see someone in the private sector where you'll for sure see somebody, but yeah, whether you can afford to pay them for each time. So yeah, I think our public services, our free services, and ones that are inexpensive are really, don't have enough people to meet the demand right now.
That must be discouraging for people.
Does that?
Yeah.
Does that lead to them not wanting to get help, or they just kind of say, okay, this isn't going to work? Or what is that impact how do you see that impact?
Yeah, I think so. Speaking for myself, and I guess just my own experiences, people have been really gracious, which I've appreciated, in just understanding that they're not alone in seeking help at this time, that they're expecting us to be busy and understanding when there's wait times and stuff. But on the flip side, it is tough. Yeah, because we've gone so many years of saying, hey, like, reach out, we're here. And then all of a sudden it's just, I don't think anyone saw this amount coming. So we had a period where things were pretty quiet because people were just, we were in shock. We were kind of in lockdown. People were busy with other stuff. And then I think started to sort of see this build and build and build and build. And even as things shift with the pandemic, I would assume that we're way not out of the woods on the kind of mental health end of things. Like, I would assume that as we see this kind of building, that we're going to be working to help people with this for a while, I think. One
of the things that we were talking in leading up to today was what it's like on the clinician side of the room.
It's so weird to, I guess, sit across from somebody and know that they're perceiving me so differently than I perceive myself. Just the same as, and I recognize this when I go see my doctor, or I go see the dentist, or I go see whoever, and I just know them in their professional role. And to me, like, this is just what they are. They're this expert in whatever. And so, I think sometimes it's funny to me to be like, I'm in a role like that for people. People come in and they tell me things like, oh, because our own stuff is so intense to us. Just, we go to the doctor where maybe we feel sheepish about sharing certain things or telling them certain things, and the doctor's like, okay, like I hear this kind of stuff all the time. I'm not worried about it and stuff. And so, I think some of that is interesting from the clinician side of the room, that's recognizing like that shared experience. Even though I'm not the client in the room, I just fully recognize, like, being in that position and coming to someone and you're expected to, it's really vulnerable, just, like other healthcare experiences and stuff. But it's one I know too. In that situation, I'm the person in that role. I am also a patient sometimes. I am also a client sometimes. And so I know that feeling. We make assumptions about a clinician, or we think about them as so different from us. But I think, it just strikes me so often, just the shared humanity of it. Just because I do this work doesn't make me perfect any of these things. Or
we've experienced a lot of like people kind of, can I get help from someone who hasn't been through exactly what I've been through? And what I think people don't realize is that even though I might not have been through the same event, I have experienced similar feelings. So I've experienced sadness, I've experienced jealousy, anger, those types of things. And so there's that relatable thing of being human, is that we all have these emotional experiences. Now they come from maybe different events, but doesn't mean that we've never experienced some of the emotions that they've experienced. So that's a way we can kind of share together, is that experience.
Yeah, I think there's always like kind of a sussing out of like, do you get it? Like, do you really get it? Because I think, even all the work that we do with stigma and stuff, people do still experience a lot of stigma when they talk about mental health stuff. They experience a lot of people who, I guess, don't get it, who give them kind of patronizing answers, or are maybe dismissive, or there's just that like gut feeling that like they don't understand. And so, I agree with you that I think people come in and I experience clients sort of just doing that gut check of like, do you get it? And it's always that, like, from, again, the clinician side is always that dance of like, well, this isn't a space for me to tell you about all the ways that I get it. But I do need to make you feel like I get it. And so, those feelings of sadness, feeling overwhelmed, feeling frustrated, feeling isolated, like all of these things are things that, like, most of us, we do have something that we draw on and can draw on to like, I get it to the extent that we need to, for me to know that, like, this is tough.
Well, I think it's a slippery slope in that area of self-disclosure, because there's elements of me from being on the, from the counselor's perspective, wanting to show that I'm also human and that I have those similar experiences, and there's things that we can relate on. But then there's the risk of, are you making it about yourself and who's the one getting the help here, right? And so I don't want to take your time away, but I also want to be able to show you that I can relate to that experience of anger or frustration or whatever that emotional response is. But I also don't want you to get the impression that I'm wanting to talk about myself. And that is something that can happen, right? And if we're not, careful, but we also want to make sure that people understand that I am not also asking you to divulge everything and then me not share anything about myself. Like, I want you to kind of know that I'm human and that I care and that there's, I have a life and full of experiences and stuff.
Even thinking about that question about, like, what's it like from the clinician side of the room? And I guess it's that dance. It's that just perpetual dance with, how do I help you know that I can do this work with you in the way that you're asking for? Because you're legitimately asking me, do I get it? But without doing exactly what you've just said. It's always a dance with that goal of, helping this person make the change that they're looking for, helping them, be supported through whatever it is that they've come for help with, and doing that dance on the clinician side of sharing, not sharing, the things that someone's asking for versus too much self-disclosure. Like, it's a real dance.
Well, and I wonder, so sometimes we don't know whether they think we get it or not, because maybe they just don't come back the next time. And so is that the sign that we didn't get it? Or, they didn't really come out and say, I don't think you get it. And it'd be like, okay, well then help me understand how I don't get it. So, like, I can talk through that, so I think sometimes we all have this private logic going on in both sides of our heads, and they don't necessarily always match up, or we're not communicating to kind of get back on the same page. So there is that, and I think goes back to your shared experience comment. There's a physiological shared experience, so whether we feel comfortable together, not in a cognitive, conscious way, but just, do we feel relaxed and safe, that you can't really put into words. It's just a feeling of that. What's kind of, do you have a description of, like, your therapeutic approach? Like, what your goals are when you have someone come into your office? like what you hope to accomplish as a clinician, that might be helpful for people to kind of on the other side to understand.
Yeah. So even in saying that, just acknowledging that like so many therapists have different approaches and like always, I talk to my clients about like, I might not be the right fit for you. The way I do this might not be your jam. That's fine. Which is the beauty of working in an agency, because I have a whole bunch of people to just say like, hey, if I'm not that fit, we can get you set up with somebody else, and that's not a problem. But yeah, my hopes for people, actually hope is a really great word, because I think when someone comes in the first time, if I could pick one thing for them to leave with, it would be like a bit of hope that they can see, maybe they can't even see like the goal, or maybe they can't even see like how we could get there, or even not even longer term, but to leave with a hope that like we can get on the same page and we can start taking steps towards what it is that they're looking for. So even in that, I'm exposing that I'm pretty action oriented and solution focused is kind of, I think, one of the bigger influences on my work. But my goal, my hope for clients is always that they leave with that sense that like we had a connection, that this is like a safe place for me to share these things and to be human in an authentic way, and then leave with a hope that we are going to get on some kind of track to head towards the things that you're looking for. And that might look like lots of things. I don't think I'm attached to any particular like way of doing things, but everyone comes in with strengths. Everyone comes in with resources. Even the people who tell me like nothing is good, nothing is going okay, they always end up telling me about strengths. They always end up telling me about resources that they have. They always tell me about things that they're doing that are incredible and resilient. It's amazing work to do. And so, I listen for those things, because those are the things that we say, hey, actually, like you've got a bunch of tools, you've got a bunch of skills. Let's build on those things and make them bigger and louder in your life, so that you feel like you're taking steps towards what it is that you're looking for.
Those that come in with that kind of nothing's going right, I have no strengths. And since we're on camera, I always kind of think, well, sometimes if you just take a different view of it, then you see it differently. And I think that's what we can be for that person is, okay, I see that you see it this way, but I have a different perspective on it. And I can see, that strength right there that I know it's hard for you to experience. I see hope as being really reflective of the experiences we're having now or in the past that shape our future. If we have a lot of negative experiences, it's hard to have a positive outlook on life. So if they can come in and have a positive experience with us, even if it's for 50 minutes, then maybe that can give them hope that things can get better. It's not all bad, that there's that positive thing. So I certainly want their experience to be a positive one, that they feel heard and understood, that they have an opportunity to feel safe. You mentioned solution focus. Just for people, what can you explain kind of what that means to you in terms of, I mean, I know maybe not from a textbook kind of way, but what you're trying to accomplish from a solution focused point of view, because there are definitely therapists in our area that are very solution focused approach, and what that might mean to people.
Yeah, pop quiz time, hey? So, and not just like regurgitate my textbook training answer.
By the way, the Canadian accent that kind of comes out is really fun for me. So the hey and the a boat, I really love. So thank you. Keep doing that. It's really been enjoyable. So thanks.
Yeah, one way of thinking about it that I remember reading about was like imagine that like you were driving down the road and your car breaks down. And so you're like pulled over on the side of the road. And so someone pulls over to help you. And they maybe start asking you about like, oh, well, how long have you owned the car? And have these problems come up before? And like, oh, this happened to you like, 3 years ago. Well, but it was like, 3 years ago, I like blew a tire, but now my engine is smoking. But they're like, well, tell me about when you blew a tire. And so then we explore how you blew a tire, and you're standing there being like, okay, like, but my engine is smoking. Like, that's what I want to talk about. And so, yeah, so I think like solution focus is, okay, your engine is smoking. So like, yeah, like what's going on there? How do we, yeah. And we might ask, like, has this happened before? And you might be like, oh yeah, it did happen before. And what happened before is I need it. So this is, I maybe picked a bad analogy because I don't know cars that well.
I think what I hear you saying
is to not get too distracted by all these other things. So doesn't mean that we don't explore the history and explore your past experiences and how they impact you now, but we're not going to go down these rabbit holes that take you further away from what you're trying to accomplish in therapy. And so I think, because that can certainly be problematic for the person who's going in and going, I just really want to figure out how to get rid of this anxiety or whatever. But it's really trying to zero in on the problem and come up with solutions is what I'm getting from that analogy of, like, let's not talk about the tire. It's fixed. It's already been solved. Let's go to the engine.
Yeah, totally. So it is important to understand people's history. It's important to know things that have happened to people that could be part of like the engine problems that we're talking about now or whatever. But you're not coming in and we're like, okay, like, let's dig into everything that's ever happened to you. Let's go back. However, you tell me this is the problem, and I say, okay, like, let's figure out what the solution is there.
But you might find out that you're not getting enough oil changes. Like, you're not doing your oil changes, which is killing the engine. So you're not doing things to take care of your mental health. So now you're decompensating, and that's kind of what's going on. So that exploration of what's causing the engine, can bring about those types of solutions, right?
Yeah, definitely. And I think it also approaches things from like, okay, well, tell me about when things were better. Tell me about like when this was going well. Like, what were you doing when things were going well? Oh, you were doing a bunch of oil changes? Oh, okay. Well, like, do you think that doing oil changes was part of things going well? Then yes, no, or maybe we try that out. So yeah, tell me about a time where there's anxiety at work or something. Well, tell me about a time where you actually felt really confident at work. And this is something really cool in solution focus, is that I have stopped asking people about like, has there been a time? And I just straight out assume that there has been a time. And like, everybody tells me about a time. It's so cool. And so they tell me like, yeah, there was, this time and I was really confident. And then we really dig into like, well, how were you confident? Like, how did that work? How did you do that? And then we start taking those skills or those things and we try shifting them over. So it builds on those strengths and those resources that people already have. And we might learn new ones, or we might say like, oh, we can build on those things. But yeah, it's so fun, because really I just get to hear about people's strengths and hear about their resources. And then we build on that and we start taking steps, because I guess to me, a lot of that hope is about, seeing that like there could be a way forward. Even tying back to that sense of hope, I just always want people to leave feeling like they can at least sense that there could be a way forward. And so, yeah, that's something that I get really excited about solution focus for. Well,
it reminds me of a question I when I do a lot of consulting with teachers and other professionals about stuff, and one of my questions I ask, especially when they're really frustrated with a kid or really struggling and they feel like nothing's going well, and I say, has there been a time where something worked, even for just a tiny bit? Like, even if it was just for a little bit, and then it'd be like, well, when I was walking him down the hallway, he was really talking to me, he was doing really well, and I'd be like, oh, see, now you're starting to realize, hey, I have a reason why that's working. I have an understanding of why that's working. Let me tell you about it. And then if you did more of it, you can start making change. So like, even in that situation, it's like, when did things work out well for you? Well, it's when I was, involved in projects and I was busy and I, did things that I really enjoyed. And, it's like, oh, well, there's a reason for that. And, and being able to kind of encourage people to do things that, even if it worked for a second, there's probably a reason why it worked. We just need to do more of it.
It's so cool, isn't it? Like, our job is so cool. It blows me away. Like, we get to do this work. It's so fun.
I think probably if we're problem solvers, if we like to kind of just, guide people and facilitate, I mean, it is fun. And certainly if a person can walk out going, that was really good, or I really enjoyed that, or that was a lot different than I thought it was going to be, that's that's always a nice thing. And if we can get people keep coming back, keep working on things, and that's great too. Do you see stigma, mental health stigma or behavioral health stigma?
There's definitely been a lot of promotional campaigns, Bell, Let's Talk, and I know our school districts have done a lot of, I think a lot of work to try to be talking about mental health. Each school district is different, but I think that it's really been on people's minds. I'd say they generally feel more comfortable acknowledging mental health. But I think that when it gets down to like somebody, either themselves or somebody in their family, it's so tough. You know, we sometimes make that comparison, be like, well, if you broke your arm, you would go get treatment for that. Right. But it's just, a broken arm is so clear and easy to see. Well, you broke your arm. I can see that you need to, like there's not a lot of mystery around that. And I think mental health is not so cut and dry. It's not so easy to see. And so I think when it's ourselves or when it's someone in our family, I think that there is still kind of a discomfort with the unknown, a discomfort with, I don't know what's going on here. I would rather you just pick yourself up, sort of, like
how we expect people to be, whether it's in the type of role you're in. So if you're like, for example, if you're a professional, you can't possibly have something wrong with you. You can't possibly have any mental health issues. We were talking about this on an earlier podcast with some nutritionists. If you're a nutritionist, you got to be eating totally like the perfect way and never have anything with sugar and all that stuff. And it's just, I just wonder, breaking your arm analogy is, you typically don't go into that doctor's office worried about what people are going to necessarily think about why you have that broken arm. Like, especially if you got it in a way that was, you got it hurt in a sports accident or something like that. You're not going to go, oh, I'm worried that the doctor is not going to like me. I feel like stigma and mental health is so relationally interlinked.
Yeah, absolutely. Because someone needs to believe you, right? They need to get on the same page as you. They need to understand your language. They need to understand what you're saying. They need to believe you, because all of this is just coming out in our communication. It's just coming out in our language. And you could observe things about people too, but it's not so clear.
So like one of those stigma statements would be like, stop blowing this out of proportion. Stop making it a big deal. Like, it's not so bad. And maybe sometimes we're trying to do that in hopes to change their thinking. Like, oh, it's not so bad. Like, it may be coming from good intentions, but then what is it experience of that person hearing that?
Yeah. If I had a dime for how many times people have told me, like, my friends or family said this, and I know they want to be helpful, but it made it worse, or it wasn't helpful, or it led to me not seeking help because I just thought I was nuts. Like, I just thought I was being over dramatic, or, whatever. And it is, there's so many friends and family out there who are trying really hard to be helpful. It's not always, motivated by anything malicious often, but still contributes to that stigma, even like internalized stigma.
Mental health, and especially addiction, can hurt. It definitely hurts and impacts relationships in a negative way. So if you're depressed, then that's going to have an impact on relationships. It's going to make, and whether that's from the person not knowing how to help that person and wanting to help that person and getting frustrated because they're not responding to it, or because you're so depressed, you're not meeting my needs, you're not helping me, and I need help. I need this from you, and all these different types of things. So we get so easily frustrated and concerned, or frustrated and reactive maybe to mental health. And maybe that comes from just not knowing, understanding, or how to help. And so we get maybe frustrated because what we're doing is not working, or just it has such an effect on everybody around us.
Absolutely. Yeah. And even too, because you think about like, okay, well, if my husband broke his leg, had to have surgery, and he had to like sit on the couch for 6 weeks, it would be like, okay, well, this is going to be tough. We've got 2 little kids or, whatever. It's going to be hard, but I understand, like, I can see what's happening. There's also a timeline. Like there's some kind of, with a lot of like physical injuries like this, there's some sense of like a timeline. And I think people just cope a lot better. I mean, even if you draw that connection to the pandemic, like it's hard for us to not have a timeline, and mental health does not have a timeline. It's really hard on relationships. And I think the unknown adds that extra layer of difficulty.
Well, and there's that subjective experience. Like I have to believe that I'm feeling better. Like I have to experience that. Whereas, that's based on my experience and not any tangible data, necessarily. Whereas, I can look at an x-ray and see that the leg is healed and you can walk on it. So that tells you that it's good. How do you guys, outside of campaigns, is there ideas or things that you guys do out there that to help reduce stigma, or I
think individually, a lot of us are trying to do what we can. We talk about our work with our friends and our family, and we talk about mental health, and we share stuff on social media, and we kind of do those things that we can kind of individually. Again, speaking for myself, I sort of, spam my family and friends with like, here's what you do if someone tells you that this is going on for them, and here's the resources that are available, and even just trying to get the word out about how someone could help somebody if they experience someone who's in kind of distress or that kind of thing. And I think that even larger than campaigns, when people are willing to be honest about their experiences, and again, like that's a really vulnerable thing. It's not something that everyone's in a space to do. It can be hard, right? Because we do worry about how people perceive us. We do worry about people are going to think, but for those who can share, at least to some extent, their story and their experiences and stuff, I think when we know someone who's gone through something, and then when we hear about that, we're like, oh, and you have that person in your head of like, well, I'm connected to that person, and I know that person. Then it's not just this, like, not this unknown. It's not a statistic. It's not just, people with XYZ, and I don't know any of them. You're thinking about actual people. And I think that really changes your relationship with something. Just like, when we know someone who has MS, all of a sudden when you see campaigns for raising money for finding treatments for MS or stuff, you think of that person and you have a wildly different relationship with it than when you just see like a fundraising campaign and you're like, oh yeah, that's like a good cause, but you don't have any personal connection with it. So I think that's one way that we can make a difference if we connect with our people, with our kind of spheres of influence, and we're willing to be authentic with them about what we've experienced, that I think that can make a big difference.
Yeah. And that vulnerability of sharing your experience, I would imagine that vulnerability is because in our head, we are thinking, oh, they're going to judge us. They're going to think how weak we are or whatever. But my belief is that we'll invariably be more relatable to the people in the public. There's going to be mental health symptoms everywhere, but people are struggling with these emotions. We're all have that same template of emotions, and athletes and actors have, expressed and been vulnerable in that way. I was thinking about like the documentary with Michael Phelps and just some of the stuff that he's, advocated about mental health. And you'd be like, Olympic athlete having mental health symptoms? That's crazy. You hear him talk about it and you're like, yeah, these aren't things that are like out of the world for people. That we all experience that stuff. He just happens to have a certain type of lifestyle that involves, high level athletic ability. Everybody realizes that we're experiencing these symptoms and it's okay.
The Canadian stats are, and this was pre-pandemic, but it was about like 1 in 4 Canadians at any kind of point in time would qualify for a mental health diagnosis. And we don't need to necessarily open up the like diagnostic can of worms, but right. That just says like, it's a lot of us. If it was not so unbelievable that somebody could be so high functioning and then also really struggle with stuff that's going on in their mind, stuff going on with their emotions, which, as you've pointed out, obviously inevitably affects their relationships and stuff, but it's a lot of us. And it doesn't mean that person stays in that place or that they don't like shift out of it, or maybe it's a season in their life or whatever. And then some people move in and out of it over the long haul, but it doesn't define who you are. It doesn't define what you're capable of. It doesn't have to define your life. So yeah, sometimes I just imagine the world I hope we're headed for, where you can be honest about it and no one's like, oh, okay, well, yikes, I don't know what to do with that.
You said that you were kind of sharing things to family and friends about how to help and things like that. And what is some of your ideas about how people can help those that are experiencing mental health struggles?
If they're going to go into peer support, even just coaching, and like, how do you support a peer? How do you do the support work for people? But yeah, just even just some of those basic, like, we've all got that instinct to jump in and tell somebody fix it. I do. Like, even though I know better, I still, fight that urge sometimes to jump in and just be like, oh, well, so that encouragement to, hear somebody. If someone's telling you something, they trust you, they've given you that trust. So like, slow down and just hear what they have to say. And even think about like, well, how would you want somebody to respond to you if you were telling them something vulnerable? You would just want them to hear you. You just want them to listen and to say like, things like, wow, like that sounds really tough, or like, thanks for telling me. And then for my folks that are closer here, I tell them about, like crisis lines that they can direct people to, or other supports that are free, like resources that they can feel confident in sharing with people. But I think even too, saying to somebody like, hey, like, I think, thank you for telling me. And like, would you be open to like me supporting you and like finding someone you can talk to? Right. Even if you don't know where that would be yet. But sometimes I know it's been so valuable for people to have a friend or a family member just be on board for their journey to even finding a professional that they can work with. Because at the end of the day, none of us wants to be alone. Like, we don't want to be alone. And so it doesn't have to be complicated to be there for somebody. But yeah, if we can suppress that urge to just like jump in and tell someone that like, you're okay, and the kind of fix it sort of stuff, then yeah, I think we can do a lot.
So I wonder if someone comes to me, personally, to talk about something that's bothering them, do I have this feeling of responsibility to solve it, when the reason why that person's wanting to talk to me about it is not necessarily to solve it, but just needs somebody to listen? Wholeheartedly agree that as friends or family of people that are struggling, our responsibility should only be to listen. And we shouldn't have this need to solve those problems, because we're not going to be able to in the way that we think we can. Number one, that person's probably not looking for that. But number two, things are way more complicated and it's just so hard to, as friends and those boundaries, to be able to do that. And then what does it do for our mental health when I'm trying to help somebody and maybe they don't respond in the way that I think they should, or whatever. But there's so much power in just being able to listen, and that's healing in itself. But coming up with a solution,
if you're someone has come to you, then there's that, like, there's already an assumption that this person trusts you. Like, they're trusting you to be the one to hear this. And it's so funny because lots of things, it's like, oh, I guess moving is maybe not a good example, because then we're like, ooh, I actually don't want to help you move. but
can I just deal with your depression? I don't want to help you move. I'd rather.
Yeah, I can totally listen to this, but yeah, I just really don't want to help you move. But no, like lots of other problems that we come to people with, we are looking for a solution. We're looking for help. We're looking for those more tangible things. And then this is just not one of them. Like we do, like you just said, it's healing to have someone just listen, to just hear us. And so I think if we're on the other side of that, like our job is just to bite our tongues, like to just push that impulse to try to fix, that impulse to try to come up with a solution, to just, that's our job. Our job is to hold it there and not let it come spilling out, and just hear somebody. Because you're right, like even though this is like my professional work, I am also a friend, I am also a family member, and I cannot do this work with those people. All of the friends and family of my clients, they can't do my job with that person. We have different jobs. And I can't be their support person. Like, I can't be there as a professional. I can't replace the importance of somebody's family support or the importance of somebody's friend support. So we just have different jobs. Like, it's healing to just be heard. It's healing to just have a space to tell somebody what's going on for us. And so if you are doing that for somebody, you're doing it, like you're doing the job. So even if the impulse is like, well, I didn't fix anything, I didn't solve anything, and this person is still going away feeling sad, you still did your job, like you still did it. And it's good.
Well, one of the things that I focus a lot on with people in my staff and everything like that is the importance of regulating. So importance of doing activities that regulate us and get us back into balance. And those aren't really cognitive oriented things. Those are walking, listening to music, doing things that help, us calm us and feel us. So I think if like we were to give any action steps for people to help is just go for a walk with them, go work out, go take them to a movie, do something that is regulating and calming. Don't try to solve their problems, but just do activities with them and be with. And then those are things that are going to be very regulating and relational and things that are going to be very, healing, where we don't have to have the right answer for everything and solve their job problems or, parent problems or whatever, but just give them experiences where they can feel better. Right. And so just do whatever brought them to be friends in the first place, just keep doing those things.
That's such a good idea. And my hope would be that that's relieving for people. Like if someone comes to you, it can feel like so much pressure, like, oh my goodness, you came to me and I want to help and I don't know what to say and I'm not, whatever. And it's difficult, but it doesn't have to be complicated, right? Like we all technically know how to listen. We just don't always practice it very much. And so it's, listen and hear them. And then like you just said, like be with them, do activities with them. And even adding on top of that, like be with them kind of without expectations. Like, cause I know from the other side, like, I hear things from clients like, well, someone's invited me, but I just feel so bad about being down, or I feel so bad about not being my like chipper self, or I feel like I can't get myself into that place. So for the friends and family, like inviting people to things or doing activities with them and just acknowledging that like they don't have to, there's no expectation. They don't have to get to this level of energy or whatever. You just want to be with them. And really there's few things that are more powerful than wanting to be with or feeling like someone wants to be with us, even in our mess. Like that's pretty powerful stuff.
Even in COVID, I recommend hugs. So, physical connection and stuff like that. I mean, I would just like thinking of like my kids throwing a tantrum and is upset and, I'm not trying to talk to them. I just go over and give them a hug, because it's like, okay, you just need to feel love and cared for, and we can get through this stuff that made you throw the tantrum in the first place. But just and so I'm probably going against the CDC recommendations, but being able to kind of be caring and just express love, and I think that's helpful as well.
Mm-hmm, for sure, yeah. Because again, like so many things we do as humans are difficult, but they boil down to some really foundational things. Like we don't want to be alone. We need to know that there's people there for us. We don't want to feel like we're just in this by ourselves. And so we need people to listen to us. And so then we need to, fight that impulse to tell people what to do and wherever that impulse comes from, I don't know. But these don't have to be complex things that we do for people, but they're really, I think, at the heart of human experience and the things that are really, really deep and meaningful to us, kind of regardless of what the specifics look like.
It's very well said. And I think it's a good place to end our conversation of just human connection and being with. And so I appreciate, Whitney, everything that we talked about today and being able to get a chance to talk with someone so far away, but still kind of having similar experiences in terms of helping people. So it knows no borders or bounds, and so being able to get to spend time with you today and learn about things from your perspective. So I appreciate it.
Yeah, it's been so fun. Thanks for having me. And it's really cool to join with people across borders in this way, particularly now. So thanks so much for having me. It's a lot of fun.